Today I am here as Dr. Saito of the Division of Neurosurgery to present to you Breakthroughs and Innovations of Medicine. I would like to start with the breakthroughs in surgery, followed by one of my specialties, the breakthroughs in neurosurgery. And then I would like to change the topic a little bit. The third topic will be the functional localization of the brain, and I will conclude my lecture by introducing the translational research. Well, have any of you ever seen the TV drama Jin? It was originally a manga written by Motoka Murakami and aired on TBS in 2009 and 2011 as a TV series. I was absorbed in watching this drama back in the day. Nowadays, the new, younger generations like you may not hear about it anymore. However, I highly recommend you take a look at it if you get the chance. The main character, Jin Minakata, played by Takao Osawa, is the chief resident of the Department of Neurosurgery at the University of Toto Hospital. University of Toto sounds similar to the University of Tokyo. So I have a sense of familiarity with it, but the actual filming location was Juntendo University. The poster they made for the TV series contains a scene in the Edo era, where a person stands on the Surugadai Plateau looking west, having a bird's eye view of the whole cityscape of Edo. At the end of the landscape, there is a beautiful view of Mount Fuji. I was moved by seeing the poster and realized, wow, so that was how Edo looked like back then. Haruka Ayase played the lead actress, Saki Tachibana, in the drama, and Dr. Minakata, Saki and their colleague made penicillin all by themselves. I felt the drama, and it was amazing to see the making of penicillin. I also find it interesting to have historical people, such as Genboku Ito, Koan Ogata, and Ryojin Matsumoto play on the same stage in the drama. But the most unexpected character of this drama must be the chief of the medical bureau. He's a very talented neurosurgeon of our time, who accidentally travels back in time to the end of the Edo era. When time traveling back to such an old age, even a good surgeon can't do anything. There was a skirmish where a warrior was injured. The surgeon tried to drain blood that had accumulated in the skull due to a head injury, but he could not make a hole in the skull at first. I still remember the scene when the mother of the warrior became enraged, yelling, "Are you trying to crack my son's head open and kill him?" In the meantime, I suddenly realized how fortunate we are. I felt keen about the medical advances since the end of the Edo era, and that we are now able to provide neurosurgical treatment. Also, since there was no penicillin, there were many people who suffered from infectious diseases. We are lucky to have penicillin and other antibiotics nowadays. From the left on this page, we have Genboku Ito and then Koan Ogata. Koan Ogata ran Tekijuku in Osaka, which you may have learned from history classes. The last one is Ryojun Matsumoto. They built Shutosho for prevention and treatment of smallpox in Edo, which is the origin of the School of Medicine at the University of Tokyo. Now, the University of Tokyo will soon celebrate its 150th anniversary, but I'm sorry to say that the University of Tokyo School of Medicine will celebrate its 180th anniversary, which is surprising. Genboku Ito first opened a Western learning school in Saga, where he started vaccinations using cowpox. Koan Ogata is Genboku Ito's disciple, while these other men established medical facilities in Edo. The first president of that time was Shunsai Otsuki, but it was actually established by Genboku Ito, who was like the Caesar in the Roman Empire. The second president was Koan Ogata, and the third president was Ryojin Matsumoto. In the Edo era, the hospital took the form of a Western medical facility, and it became the medical school of the University of Tokyo in the Meiji era. I was very much impressed by these predecessors. and I was also very impressed by what happened in history. First of all, let me show you the chronology of the progress of surgery, which I hope you will find useful. I will now explain each of them. At the very beginning, Hippocrates is said to be the father of medicine. And he established medicine as a profession. So, what was the state of medical care before Hippocrates? That was a spellbound era, like a world of magic. There are examples such as Ummyoji in Japan or Zhuge Liang in China, who are mystical people able to cure others' injuries simply through praying or casting spells. Those have nothing to do with the establishment of the medical system. It was Hippocrates who first began to spread the message that medical treatment should be done more scientifically. Another important accomplishment made by Hippocrates is the book, Hippocratic Corpus. Hippocrates and his disciples left behind a collection of records of their research. It includes, for example, medical treatments related to childbirth. Such records of what they did have been preserved for posterity. This also tells us that it's important to write papers. I'm serious. Let's put it this way. I'm going to talk about those who didn't leave their work for posterity later. In the collection, there is a book on injuries of the head that describe the procedure of trepanation. Such surgery is made by drilling a hole in the head. It seems that neurosurgical techniques probably started around this time. And even though we have gotten out of the world of magic and spells, we are still in a time when, in essence, we don't know much about the human body. Claudius Galenus, from 129 to 200 AC, was a young Greek physician then. He did some experimental work, such as finding arteries. Beyond that, he also developed a conceptual medical system. However, it is said that his creation is also one of the reasons why the medical treatment did not progress too much until the Renaissance. For example, there is the theory of humorism, which states that the balance of 4 body fluids, blood, phlegm, black bile, and yellow bile, are keys to the cause of human diseases. Nowadays, anyone would think such concepts would not be possible. But back then, because it was said by an authority, it was taken for granted. Even nowadays, we can still hear traces of professional words containing the concept from that humorism. For example, there is still a term for sanguine temperament, which means a temperament with a lot of blood. And there is also a term for phlegmatic temperament, which refers to the state of phlegm inside the human body. In the medical world, when a patient is in the late stages of cancer, blood test data becomes untrustworthy and inconclusive. In the sense of humorism, it means all 4 of the body fluids have gone haywire, and the patient is in a state of plague temperament, which is called cachexia in medical terms. So, although there are vestiges of such terminology, they have no basis in reality or modern science. A similar thing happens in China as well. For example, in China, a similar classification system of the 5 elements of yin and yang has been developed. Unlike the 4 elements above, they have 5 elements. But there is not yet scientific proof of their existence at all. The person who greatly changed this trend was a man named Andreas Vesalius, who wrote On the Structure of the Human Body during the Renaissance. Listed here are the names of the book in Latin, Japanese, and English from top to bottom. The paintings on the left are famous. and I believe everyone has seen them once or twice. Compared to the abstract paintings of the previous era, the painted human body is now quite realistic. The brain is depicted quite accurately, even coinciding with our knowledge of the human body today. Vesalius accomplished such an achievement by dissecting human corpses and studying their brain structures. One reason there was no precedent of him being able to do such a thing was that, until then, regulations for dissecting corpses had been influenced by religious beliefs. Dissecting human bodies was not something that everyone would want to do, and it was also a time when it was religiously prohibited. It became possible in the Renaissance period because people started to become aware of the importance of thorough examination of the human body, and it became possible to do autopsies with the permission of the clergy. Vesalius embraced the trend perhaps too strongly, even uncovering graves to find bodies. Da Vinci was also from the same generation, and they share a common contribution in leaving paintings of accurate human body structure based on the autopsy. This was a breakthrough in surgery. Then there's this man, Ambroise Paré, who worked as a French barber surgeon. You may have heard of barber shops, but not barber surgeons. Back in the old days, barber shops did the surgical work. This is because the physicians wanted to prevent getting the environment dirty, and they thus chose barber studios as a separate space to stage surgeries. Paré has the nickname of Gentle Surgeon, and he is the pioneer of treating wounds with bandages. What was going on before then, in other words? There was no concept of blood circulation or the like yet. In this case, for example, you may have seen movies or TV dramas like Rambo, the Invincible Hero. He played a very active role. Rambo defeated lots of bad guys, but also sustained heavy injuries. Then, when there was a short break, he would heat and burn his blade. Touch the burning blade to his wound to cauterize it and try to stop the bleeding. You may have seen this method used in the past to stop wounds and blood loss. This is a very old-fashioned way to treat wounds. For example, burning the wound with a burning iron or burning it with oil. It does not seem to be a good treatment, and it sounds painful. Such treatment only makes things worse. There was an accident where Paré ran out of oil while treating a wound. So he wrapped the wound with bandages, and it worked. He discovered it by chance, and since then, bandaging wounds has become a common treatment. As I mentioned earlier, the circulation of blood was discovered by William Harvey through animal autopsies. He found that blood circulates through the body from the heart to the body and back again. This was something that could not have been understood in the age of magic before that. And this also played an important role in the advancement of medicine. The next category of important innovations for surgery is related to anesthesia and disinfection. This person is Hua Tuo, a Chinese doctor, and his history dates back to the period from 140 to 280 AC. It is said that he developed and used an anesthetic called Mai Feizan during the Three Kingdoms period. In the middle of this page is an article in the newspaper written by Sano Keiji, the first professor of neurosurgery. He wrote this article when he got his position. It is well known that Cao Cao suffered from headaches for a long time. By then, Hua Tuo recommended Cao Cao to undergo brain surgery. However, this made Cao Cao angry, as he thought that cutting open someone's head could only lead to their death. Cao Cao tortured Hua Tuo to death because of that, and the unfortunate part is that his wife burned all Hua Tuo's medical records just to avoid being implicated in the crime. Due to this tragedy, although mafezan is thought to be an anesthetic, we have no record of how it was actually used back then. So his newspaper article was actually encouraging medical students to write papers on the subject. In fact, when talking about general anesthetics, there is one person well known in the Japanese history. Seishu Hanaoka developed Tsusensan, which is believed to be the world's first general anesthetic. Maybe you are all familiar with the story of his innovation. In order to develop this drug, his wife and his mother both volunteered to be test subjects, and Hanaoka tested the drug on them. Unfortunately, his mother died and his wife went blind. This happened hundreds of years ago. Please be aware that it is a human experiment and cannot be done nowadays. This was possible because of the era in which it was developed, although regulations are now much stricter regarding human experiments. After all, Seishu Hanaoka's innovation in anesthetics is regarded as a great breakthrough in medical history based on great sacrifice. At the time Japan invented general anesthetics, the nation was still secluded and the technology did not pass to the West. It is generally believed that Morton was the first to invent ether anesthesia in Western countries. However, at that time, the patent system was already in place. Declaration of inventions became a matter of money. In fact, there is at least one story disputing who was truly first to make the invention. It is known that Morton was actually taught by a person named Green. But he then advertised the invention as his own. This is an episode in the field of pharmaceutical development and medical products. Similarly, chloroform anesthesia was invented by a man named Simpson. Chloroform anesthetic appears in a lot of TV dramas, where people often put some sort of liquid on a handkerchief and cover someone's face to incapacitate them. It started in this era when chloroform anesthetics or ether anesthetics were invented. We do not use such drugs now. Ignaz Semmelweis is known as the father of nosocomial infection prevention. He advocated hand washing with physician's chalk as a method of prevention of postpartum fever. That is, washing hands during surgery or childbirth. These disinfection measures are now a common practice to prevent nosocomial infections. Semmelweis discovered this fact hundreds of years ago by noticing that the incidence of obstetric fever was totally different between wards owned by doctors and those owned by midwives. This means the fault of infection was not the midwives, but the doctors. To talk about the reason behind infection, it led to the autopsy I mentioned earlier. At that time, there were no gloves, but the doctors did a lot of research based on autopsies, where the source of infection was spread from the corpses to the doctors. This would mean that bacteria were further transferred to the patient or pregnant woman. Of course, the concept of bacteria was not well understood at that time, and the detailed reasons were unknown. But at least Semmelweis recognized the importance of hand washing before surgery or treatment. Pasteur is well known to all of you. He is the one who discovered that bacteria do not spring up naturally, but come from outside sources and multiply by dividing. Nowadays, we have aseptic cells, where surgical instruments are thoroughly sterilized. However, there are various levels of sterility. If there are no microorganisms, they will not multiply within the human body. Sterilization is a method to achieve an aseptic state by completely eliminating the microorganisms. However, if you want to achieve an aseptic state, the requirements are quite demanding. In such a context, disinfection is used. You know, your bodies can somehow do that by themselves. When the number of microorganisms are decreased to a certain threshold, they will no longer increase in total number. The best sterilization method is autoclave sterilization. For people in the field of life sciences, autoclaves might be a daily practice. There are other methods, such as using gas to attack bacteria, but these methods are less effective. On the other hand, disinfection can be done with hot water disinfection methods, boiling methods, or various disinfectants on the market. But as I said before, all these methods cannot eliminate microorganisms completely. Joseph Lister advocated sterilizing surgical instruments and wounds with phenol for the first time. That is how this kind of disinfection was started. The most important breakthrough was made by Alexander Fleming, who discovered the antibiotic penicillin. Since then, it has been able to save many patients suffering from infectious diseases. Now I would like to talk about neurosurgery. As you can see here, neurosurgery treats a variety of diseases, such as cerebrovascular diseases, head injuries, functional disorders, spinal lesions, infectious diseases, etc. Here is how students learn about such surgeries. I can show videos of actual surgery scenarios to the students from the Faculty of Medicine, but I cannot show you today. Instead, I want to introduce surgery simulation. It is part of my research to develop the simulation. It is common to consider the strategies from CT and MRI pictures. This software was developed based on the idea that if the various images were made into an all-in-one three-dimensional format, it would be easier to understand and have an educational effect. This is why we developed the software. And the biggest breakthrough to make the development possible was AI. For example, please look at this MRI picture. If you want to draw the brain from the leftmost MRI picture, you have to extract only the brain from this picture. This is called segmentation. Or if you want to divide the brain into frontal and temporal lobes, you have to extract only those lobes. It is quite tedious to do it manually. However, with the development of AI, we have succeeded in developing a system of automatic segmentation and simulation using AI learning. This is a demonstration of how it works. By simply inputting the MRI pictures, this forms instantly. At first, I made buttons to allow interaction, but then I figured out that those are not needed, since computers process the data extremely fast. We still have to eliminate some parts of the model manually, but that is minor. And those can be done very quickly. And the blood vessels are shown. You can see the arteries. Then the veins. And finally, attach the skull. We can now proceed to the simulation with the model. Then we drill a hole in the brain, and all the following simulations recreate the actual surgery. Between the frontal lobe and the temporal lobe, there is the Sylvian vein. We go into the way between the frontal and temporal lobes to find the aneurysm. If the aneurysm ruptures, then subarachnoid hemorrhage will occur. So as a surgery, we press down the aneurysm using a clip. This is the kind of simulation we usually do in our lab to practice surgery skills. One person who contributed greatly to the progress of neurosurgery was Harvey Cushing, an American neurosurgeon. He was also a very good artist. And the picture on the right is one he drew himself. He was involved in the treatment of many head injuries caused by the war and established the modern field of neurosurgery. As for the neurosurgery development in Japan, it all started with this German military physician who came to medical school of University of Tokyo to teach. The machine he brought with him is shown on the right. And it's actually a tool for piercing the head. This means the University of Tokyo owned such tools from the very beginning. However, the first neurosurgery was performed by Susumu Sato. He performed an operation to cure a soldier who suffered a gunshot wound to the frontal region of the brain during the Satsuma Rebellion of 1877. This special kind of surgery has the name trepanation, in which Sato drilled a hole and removed the bone fragment as well as the bullet from the soldier's head. Unfortunately, they did not have penicillin at the time, resulting in the death of the patient due to infection several days after the successful operation. Overall, this surgery attempt failed in the long term. The first successful one was performed by Julius Scriba. There are bronze statues of the two men at the Gotenshita Ground Park. One of them is for Scriba, the other one is for Erwin Balls, who is a co-founder of modern Western medicine in Japan. Scriba was a surgeon, and it is said that he performed the first successful case of neurosurgery in Japan. In 1892, he operated on a depressed fracture, and his colleague, Hayari Miyake, reported the results in a paper. That is why the record of this surgery has been preserved. By the way, the University of Tokyo created the third division of surgery for him, which later became the neurosurgery division you all know today. He is definitely our ancestor in neurosurgery. There were several breakthroughs in the development of neurosurgery, and one of them was microsurgery, surgery under microscope. Following the development of microsurgery, NCT and MRI were developed. A chronology of them is shown here. This is an example of hypertensive cerebral hemorrhage, where the white area on the left is a hemorrhage. As you can see below, by entering this dome-shaped CT machine, the doctors can see the structure of your head. Until then, there were only simple photographs, and doctors always had a hard time diagnosing the brain, to say nothing about actually offering treatment. If you think about it carefully, the head is divided into many functional blocks, like a series of equations. From the absorption values of the X-rays transmitted through these blocks, the root of the equations can be solved. Hounsfield, the inventor of this technique, was awarded the Nobel Prize. Similarly, the white part on the left image is a subarachnoid hemorrhage. The cause of this hemorrhage is investigated by taking photos of blood vessels, called angiography. Here you can see a round aneurysm. Igaz Moniz, the person who developed cerebral angiography, showing blood vessels as an image of branches, also won the Nobel Prize for this invention. The MRI machine is an imaging device that captures images of the brain with an extremely strong magnet. It can depict malignant brain tumors like this with high resolution, or depict metastatic brain tumors as white spots and black dirty spots that can be visualized. If the lesion can be visualized in this way, it will be possible to treat it by removing the lesion. at the beginning of this lecture when I mentioned Jin. It was common sense to say that we cannot drill holes in people's heads. But here is how we are doing it in surgery. The drill on the left is used. The drill has a push-button tip and drills a hole in the black circle on the right. The drill turns as long as it is pressed, and stops when it jumps over the bone and the pressure is released. Therefore, it is possible to drill a hole without damaging the brain, which is located behind the skull. There is a tool with a guard attached to it in the center left of the blue circle, where the bigger hole is drilled. The guard tool connects the smaller holes and guides the trace to be cut. The bone of the skull can then be removed. Microscopes have made it possible to magnify such small parts of the skull, such that brain surgery can be performed safely. In addition, there are many other surgical instruments. Inventions of surgery instruments increased drastically after the Meiji era, thanks to a lot of efforts by many inventors. These instruments are indispensable to neurosurgery performed today. As you can see here, we have navigation systems, electric burning devices, etc. Let me change the subject a little here. One of the brain functions that neurosurgery has discovered is the functional localization of the cerebrum. The leftmost picture depicts a typical paraplegic after a stroke, but there are also other various divisions, such as the agnosia patient on the top right or the apraxia patient below her. These are somewhat unusual symptoms, and I would like to talk a little about them. In the past, the brain as a whole was thought to be chaotic and to harbor consciousness. But with the advent of brain surgery and the understanding of brain diseases, it is now understood that there is a localization of functions in the brain. I am sure everyone has studied this in high school and junior high school, so I will go on. Wilder Penfield is the neurosurgeon who discovered this phenomenon. He said that it was as if there was a little dwarf living in the brain. Imagine a homunculus, a slightly creepy doll, lived in our brain. This is how Penfield described the functional localization back in the day, and it has been proven correct. Each function has a specific location. This is related to the use of general anesthesia. It was a good thing back then because there was only local anesthesia, but then general anesthesia became more commonly used, although we don't really see such things anymore. Local anesthesia is now available in very good quality, and a new method called awake surgery has recently been introduced, in which the patient is anesthetized while the head is opened, and the patient is awakened to check brain functions to see if everything is okay before surgery is performed. Then, for example, when looking at the main functional areas colored purple, functions such as talking may be disabled by stimulating certain areas. Doctors can then make a map of functional areas according to the response of each area to stimuli. Here, the right side is a 3D model of the brain, and the left side is a cross-section of the brain. Please pay attention to the location of the central sulcus and interparietal sulcus. The red dotted area in the front is the central sulcus, which is the central control area of movement. The blue dotted area behind that is the interparietal sulcus, a mysterious area. I would like to explain a little bit about the two sulci. But before that, you need to understand how vision is perceived by our brain. A scene is interpreted as an image on the retina, and signals representing the image go through the optic nerve and optical radiation as shown in the red lines. At the end of the optical radiation, the signals go into the calcarine sulcus. Up to this point is what people commonly know as how visual perception is achieved. But what is happening beyond this point? In fact, what happens beyond this point shares similarities with what occurs in the world of AI. We have no idea what actually happens when the signal is passed to the synapses. As the signal goes further, the brain processes the signals in many ways and eventually outputs a combination of them. The processor of visual information has three major ways to process the signal from the visual center onward. The dorsal side is colored blue, where the information is judged. This indicates the information that answers how. The red backside processes the signal to indicate where, meaning location-related information. Then the ventral side shapes the form of the information, answering what. These pathways are how signals can be processed on the software side. I explained the way visual signals are processed in the brain, with ventral pathway being one of the three route signals would travel. Today's lecture is not for medical school students, so I will not talk about this pathway in detail. But it is noteworthy that the ventral pathway is extremely important. If any spot in this pathway fails, the patient will have specific symptoms. The following is a list of the symptoms. These are visual agnosia, states where patients have little or no recognition of what they see. Here are some examples. Inability to recognize an object is called object agnosia. Agnostic dyslexia is for letters, and prosopagnosia is for faces. And the inability to recognize scenery is called environmental agnosia. Now I will provide details on how two of these visual agnosia happen. Prosopagnosia is caused by this red area, which is called the fusiform gyrus. The patients recognize the fact that they are looking at a face, but they cannot recognize whose it is. One of my previous patients got prosopagnosia 3 months after neurosurgery. Fortunately, this is an acute symptom, and he recovered after a while. This was caused by a lesion. For prosopagnosia patients, they feel like they are holding a face, but do not know whose drawer they should file the face under. If a functional failure happens slightly further within the brain, environmental agnosia occurs. This area functions as a record of how to get to certain places and back, or how you can remember your position in a room. It is this slightly more interior area that engraves such information in your memory. It means it is a little more internal. Here's how brain tissue works. The further inside, the older. The further outside, the newer. So the memorization of environments is a very old and basic skill from early in human evolution. The blue part is the flow of the visual signal. It separates the area responsible for somatosensory or body sensory information. Such somatosensory information is then combined with visual information, allowing us to understand the meaning of the information. In other words, the flow for us to understand something is by extracting combined information from sensation of touch and our vision of it. For example, in this case, if this blue flow of somatosensory is damaged, ataxia optique, or impaired grasping symptoms will occur. That is to say, the patient will become unable to stretch their arms and grasp. The linguistic center is located in this area. As I mentioned before, the inner areas are much older. While the closer it is to the crease, the newer the brain is. In other words, the hand grasping is something acquired long ago in the process of human or animal evolution. Environmental memory is also an old skill. As the human brain evolves, the most recent additions to the brain include the facial and linguistic recognition areas. They both belong to the outermost area, which is believed to be the most recently evolved area. I'm extremely interested in the supramarginal gyrus and the angular gyrus areas, which both belong to the inferior parietal lobule, because these areas are said to be closely related to the consciousness and cognition. The mysterious thing is, when part of these areas is damaged, let's say, if the blue area is damaged, we cannot see the movement of things. That is to say, it's as if you are looking at one scene in a picture story show, and suddenly you are in the next scene without any transition. It is in this blue area that we recognize things moving. If you think about it, even movies and TV shows are just moving pictures. I've always wondered why continuous frames can make a scene appear to be moving, rather than remaining motionless. It is because the human mind originally sees things only in intervals and understands these discrete sequences of images as one continuous motion. That kind of sensation function is housed in this ventrodorsal pathway. If this area is damaged, you may see only the red triangle or the blue triangle in the bottom right. Or you may see a camel, but not the pyramid over here, and vice versa. Such strange symptoms could manifest. There are even more possible symptoms: agraphia, acalculia, finger agnosia, and right-left agnosia. These are all disabilities of high-function human abilities. If you look further into these agnosia, there is hemispatial neglect and personal neglect. For instance, if the right area is damaged, the patients will feel as if they do not have the left half of their body. Since the patients will feel they do not have the left half of the body, they will face right all the time, as if they only have half of their bodies. This is a symptom that the patient is neglecting half of their personal being unconsciously. In other words, this new area of the brain is quite an important part of human intellectual activity. For more information on the content I've introduced here, please refer to the textbook, Understanding and Diagnosis of Higher Order Brain Dysfunction. I will conclude my lecture as follows. I've discussed how early medical advances dispelled myths and listed some of our predecessors' contributions to advances in surgery. Also, the operating microscope, CT, and MRI were important to the advancement of neurosurgery. Finally, I would like to conclude that current medical care is built on the accumulation of many innovations. Thank you very much for your kind attention.